Okay. Hello, class. My name is Kelsey Huvelman, and the topic for this week is living environment. I'm sitting here with Nancy Higgins. She is a BSW at Columbia Manor Care Center, which is a nursing home here in Columbia. So I'm just going to sit here and talk with her, ask her a few questions about living environments, and she's just going to share some of her knowledge and experiences with us today. So Nancy, first of all, what is the difference, or what are the differences between a nursing home and assisted living facility?
Well, assisted living facilities, actually the bottom line for that is the people who live there have to be able to make it to a path of safety on their own. In a nursing home, the residents are dependent on the staff to get them to a path of safety if it were needed. If it's reminding or assisting or actually physically moving them, they are more dependent. And so that is the determining factor for being able to stay at assisted living level. Now, they are provided some nursing care, not at the level that they are in a skilled facility. The payment source is different as well. The assisted living facilities accept private pay, and nursing homes are able to accept Medicaid and Medicare, private pay, insurances, those kinds of things. So sometimes even we have had residents who have been able to live at that lesser level, but financially they couldn't, so they ended up staying here with us and enjoyed their life here, but probably could have gotten by at an assisted living. They get help with their housekeeping and linens on a weekly basis at assisted living. Here it's daily. The rooms are clean, the beds are changed, and they have all that kind of help. And they have help here with all their activities of daily living, with the bathing, grooming, being brought to the dining room. Some folks are able to make it with just reminding them that it's time to eat their meals, but most of them are dependent on us to come get them and assist them to the dining room. Some people require being fed here at skilled nursing, and that doesn't happen at assisted, or queue to eat. Some, of course, are able to feed themselves. But basically, the bottom line is they need to be independent enough to be able to make it to a path of safety in assisted living.
Okay. And for the seniors who choose to live at home and age in place, what type of services are available for those elderly persons?
There are many services available to help them stay in their homes. If they have health needs, there's home health, PT, physical therapy, occupational therapy, and nursing care provided by many companies here in town. They are also covered by some insurance, Medicare and Medicaid, to get those services. They have homemaker services as well. They can come in and help with cleaning, they can do errands, they can do grocery shopping, those kinds of things. They can have an in-home aide who can come in and help them to bathe or help them with their personal hygiene areas. There's Lifeline, which helps. It's a button that they wear around their neck, or some of them are on a wrist band, but they push a button if they have fallen or need some help and they need assistance. They can push that button and get some assistance. There's Meals on Wheels, who bring in some meals, noon meals, and they bring some frozen ones to tide them over the weekend as well, plus visit with their folks and give them a little socialization that way too, so that's helpful. There's also adult daycare for people who choose to stay in their homes. Maybe they have family who can check on them in the evening, stop by early in the morning before they go to work and later in the evening, but the daytime needs to be filled. There's adult daycare, and there are 2 locations for adult daycare connected with the University of Missouri, and they provide activities and meals and nursing care that they need during the day, and then they go back home at night. There are agencies here in town, CMAAA, which is Central Missouri Area Agency on Aging, and Boone County Council on Aging, and they provide services. They can provide volunteers to come in and help with some maintenance in the yard or the home or errands or those kinds of things. There's also the senior center, where people, if they're able to get out and about, they can go and socialize and have meals and have some fun. So there are a lot of services in place to help people stay just as long as they can.
All right. So this is kind of a broad question. I know there's many ways to answer it, but how does a senior make the decision between all the living options available? Are there like certain things that they need to like be considered like more than others, or how do they make this decision?
A very difficult decision to make. Being independent and in your home is the best. There's no place like home. There is absolutely no place going to be like home. But some people have more support than others. They may have a family that are able to step in and help them to stay in their home. They may have a support system or put these other agencies to work to help them do that. Some people are not able to do that. And so then their physician is a good starting place, have a good physical. There's a SAGE team over at Green Meadows. It's a geriatric team that assesses and evaluates, and they have a doctor and a nurse practitioner and a social worker and a dietitian, and they all evaluate, assess their skill, their level, the skills that they need, or not the skills that they need, but the assistance, the amount of assistance that they need, and how well they're functioning in their homes, and whether they need a higher level of assistance than they have. And they can give that recommendation to the patient themselves and their family and talk about it that way. There's always the people in your support system. If they talk with them, talk it over, see that they're having some problems, be open and honest with the physician about your problems with daily living, be open with your family about that, maybe be open to the idea of an alternative living situation.
Okay.
It's important too that if you see that maybe you're lonesome during the day, maybe the family's leaving to go to work and you're lonesome during the day, or you're not able to cook, or you just feel like you need more people around you, get out and visit the facilities, as options to see what's out there, see what it's like to be in a nursing home, and talk with the social worker, talk with some of the other staff, look at the residents and how they're doing and what kinds of things are going on, and the activities, what they actually do during a day, to just get an idea. Even if it's not something that you're going to have to do right then, it may be something that you know that you may need down the road, and you would know. You would have a plan B in place.
Okay. And lastly, do you have any advice, or would you have any advice for seniors who are facing this decision? Like, what do you normally tell them if they come to you?
Well, we do tours with folks. We do tours with folks who are looking at the facilities, trying to weigh their options, trying to decide what they need to do. And as far as staying at home, just keep doing absolutely as much for yourself as you possibly can to stay as strong as you can. Take advantage of family who will help you. Talk to your family. Talk to them about issues going on. Brainstorm a little bit what you can do, what services you can get in the home to be able to stay there in the home, what the family is willing or able to do to assist in that process. And then again, some of our folks come to us, they have been in the home and maybe they've had a fall. That can happen as people age and they're not as able to do things for themselves as they have been. They may have a fall, or they may get ill and go to the hospital, need to come to a nursing home to rehab, and that may be their first experience with a nursing home, and they learn that it's not a bad place to be, and people treat you well, and there's people there to help, and that sometimes can help in a transition. If a person gets to that stage where they're not able to stay on in their home and be independent, they can just see that it's okay, and we have activities, and we have good food, and we have nice people, and our nurses are great, and a doctor visits once a month to make sure that they're doing okay, and of course we're in touch with them in the meantime too. So it's a very difficult decision, maybe one of the hardest ones you ever make in your life.
Probably.
Whether you can continue on.
All right. Thank you so much, Nancy. We really appreciate your time, and I don't know, I guess have a good rest of the day.
Thank you.
Okay.
Thanks for coming, Kelsey.